Assalamu alaikum. My name is Abubakar. I am here to present you my presentation about history taking and physical examination of endocrine system. I am with my group members Dr. Mubashir and Dr. Ansar. Here is my presentation. These are my group members. First, we have to take the history of the patient. We gonna ask about the personal and social history, in which we have to ask that if the patient's name and about his family status, like he is married or single. About his living, is his he is living with his parents or living alone. So personal history and social history. Then we have to ask the patient about why, about the concern why he came to the hospital and visit the hospital. So we have to ask about the symptoms of the disease, like what's bring the patient to hospital. In which we have to ask about the main symptoms. That's why he came to the hospital. We have to ask that when these complaints started, and how much weight did you lose or gain. Were there any changes in your appetite? Is there any other symptoms? Did you experience these conditions before? Do you have any medical problem or condition in past? Does any other family member in with these similar conditions? And we have to ask the medical history, in which we have to ask the prescribed and non-prescribed drugs. Is the patient is taking any medicines? There is the history taking in thyroid system. We have to ask the general questions, like his name and why he came to the hospital. So make before taking the history, we have to provide the patients a comfortable and peaceful environment. In personal information, we have to ask the patient name, age, gender, occupation, and nationality, and address. Presenting complaints, ask the patient about the main problem that made him her went to see the doctor. History of presenting illness. Allow the patient to provide an account of recent events in his or her own words without interruption. Ask the patient when the condition started. Ask how much weight was he lost or gained. Ask any associated signs and symptoms, like increased appetite, nervousness, weakness, difficulty in sleeping, hair loss, shortness of breath, and diarrhea, etc. Because we know that in thyroids we may experience about weight loss and gain, and disturbance of sleep. Uh, so we have to ask the related questions if we suspect it's a patient of thyroid gland involvement. Past medical history, ask about the similar episode in the past. Ask about any previous history of goiter and thyroid problems. Ask about other medical conditions or congenital problems. Ask about any history of surgery, particularly in thyroid, parathyroids, or pituitary gland. Ask about any history of radiations or chemotherapy. Again, ask about previous hospitalization, allergy, blood transfusion, and trauma history. It's important to ask the family history. Ask about significant illness in family, like orphans or diabetes mellitus, similar illness in the family. Uh, Mubashir?
Assalamu alaikum. My name is Dr. Mubashir, and I'm here for your examination of thyroid gland. Would it be okay if I examine you? So, what's your name? Your age? Are you single or married? Your gender? And your occupation? Student. First of all, we have to examine the neck of the patient from front side to look for a goiter if there is any goiter present. No sign of goiter is present. So while taking his personal data, so we should assess the voice of the patient. If the patient's voice is low, characteristically low, it is the case of hypothyroidism. I'm gonna ask you some questions. Please cooperate with me. First of all, we have to ask the patient about his sleep routine, because sleep routine is disturbed in the case of hyper and hypothyroidism. And at what time do you sleep usually? बताना. At what time do you get up in the morning? If a patient sleeps less than normal, it is the feature of hyperthyroidism. And if the patient sleeps more than the normal, it will be seen in the case of hypothyroidism. So while taking his personal information, we have to check the pressure of speech. If it's a pressure speech, it will be seen in case of hyperthyroidism, and slow speech is the feature of hypothyroidism. Sir, do you have any heat or cold intolerance? No, no heat intolerance, no cold intolerance. If the patient have heat intolerance, it is a feature of hyperthyroidism, and if the patient has a cold intolerance, it is the feature of hypothyroidism. Do you feel any change in your appetite? Okay. If the appetite of the patient is increased, it is mostly seen in the case of hyperthyroidism. And if the appetite is decreased than normal, it is the feature of hypothyroidism. And how many times do you go to washroom? Sorry? 2 to 3 times a day. So 2 to 3 times a day is normal. So diarrhea is seen in hyperthyroidism, and constipation is seen in hypothyroidism. Do you notice any change in your weight? No. So the patient weight gain in case of hypothyroidism because of constipation. Despite poor food, the patient will gain weight, and despite good food, patient will lose weight in case of hyperthyroidism. So I'm gonna examine your skin. So could you take your hand out for me? So I'm going to examine the skin, whether if it's thick or thin. The thinning of skin is seen in the case of hyperthyroidism due to proteolysis, and in case of hypothyroidism, the skin will be thick. Do you feel any difficulty in combing the hair? No. Do you feel any difficulty in the case during climbing the stairs? No. So it is mostly seen in the case of hyperthyroidism because of proteolysis. Do you feel any bone pain? No. So bone pain is also seen in the case of hyperthyroidism because of proteolysis. So can you move forward your hand? I'm gonna examine the clubbing. So no clubbing is present. Clubbing is present in the case of hyperthyroidism, and I'm gonna look for the tremors. So I'm gonna put papers on your hand. I'm looking for tremors. Mostly the peripheral tremors are seen in the case of hyperthyroidism. Now I'm gonna feel your palm for sweating. There's no sweating. Sweating is also seen in the case of hyperthyroidism, and no palmar erythema, which is also seen in the case of hyperthyroidism.
Are you finished?
I'm gonna check your radial pulse. We'll check the rhythm, volume, and character of the pulse, because tachycardia and atrial fibrillation is mostly seen in the case of thyrotoxicosis, in which the T4 is increased. Can you please look forward and keep your chin still and follow my finger? If the patient vision is poor, so we might give a bigger target because of the weakness of the eyesight. So I checked if there is any lid lag, because it is seen in the case of hyperthyroidism, and I'm gonna examine the periorbital puffiness, which is mostly seen in the case of hypothyroidism, and there is no periorbital puffiness is present. So can you swallow? Please again. Uh, I checked, there is no sign of goiter present. So, can you please swallow again? Again. The thyroid gland moves up and then down normally. So, we have to check the size and shape if there is any goiter is present. So, we will measure the maximum if there is a goiter present. So, we will measure the circumference by using the measure tape. So, I'm going to check for his peritibial edema. No peritibial edema is present.
As Dr. Mubashir explained all the examinations we have to do in thyroids, in physical examination of thyroids. So here the some points. As we already take personal history, if the patient is female, we have to ask about her last menstrual period, and the age of menopause. If patient is elderly, ask about any members of pregnancy, members of children, and history of complication during pregnancy. As Dr. Mubashir already thoroughly examined the all systems in cardio and respiratory system, we have to ask about shortness of breath, cough, chest pain, ankle swelling, etc. As we already know that in case of hyper and hypothyroidism, these all systems are involved. In hyperthyroidism, we have faced the shortness of breath in anxiety, and also that we have we might feel chest pain and ankle swelling, etc. In GIT system, ask about having weight loss or weight gain, nausea, vomiting, diarrhea or constipation, abdominal pain, excessive thrust, etc. As in case of hyperthyroidism, we might have these changes. In hyperthyroidism, we might weight loss, or in some cases we gain weight. We also have nausea, vomiting and diarrhea related to hyperthyroidism. We have to ask about neurological symptoms. Ask about having nervousness, irritability, fatigue or seizures. Ask about having headache, dizziness, ringing in ear, change in hearing and vision, smell or taste, etc. Urinary and reproductive systems. Ask about having increased frequency of urinations. Ask about having burning or pain while passing urine. Frequency of urination, blood in urine, etc. Ask about having penile or vaginal discharge, hesitancy or urgency of urination, poor urinary stream or dribbling, etc. In dermatology, ask about having skin rashes, redness, or itchiness, etc. As we know that the patients know better than us about her or his skin, so he might tell you some important things about her or his skin. Ask about having skin pigmentation, dryness, or sweating. Musculoskeletal system. Ask about having joint pain, stiffness, muscle pain, weakening, etc. This is previously explained examination history of patients and doctor. We have to do examination. In examination, we have four steps. First, inspection, palpitation, percussion, and auscultation. As Dr. Mubashir already take these, so we have to see the other symptoms of hypothyroidism. As Dr. Mubashir already explained all these symptoms, so look: thinning of hairs in hypothyroidism, loss of eyebrow hairs, enlargement, enlarged thyroids, dryness, constipation, poor appetite, hypothyroidism, fatigue, obesity, fatigue, cold, joint and muscle pain, hair loss. This is the case of goiter hair, enlargement of thyroid gland. Now we have to take the adrenal gland history. As the personal history, we already take present complaints, thickness. Maybe I am getting this is summarize. बस summarize करते हैं.
Somebody's patient is perfectly normal. He has no hormonal imbalance, no goiter, no features of hyper and hypothyroidism. So, due to shortage of time, we only focus on the thyroid gland. So, patient is normal. Thank you.